All right, well, we will go ahead and get started today. Thanks everyone for joining today. This will be our first um, live Fast Five event that we'll be doing. These will all just be 5 minute quick little tidbits of information, and we'll go from there. Feel free to have any comments, any questions, go ahead and just put them in the comment section and we will cover those during the discussion in this 5 minutes. So data routing is what we're going to be talking about today. And, the time spent on data routing is insane. And radiology departments have faced the problem of data movement for quite some time. And so routing data takes a lot of different forms, and it really is impacted by the quality of data, and how those data is labeled. If you, for example, don't have the right email address, you're going to have to search for that email address. You're going to have to see that it bounced back, and you're going to have to do some other things to get that email to the intended recipient. There is no difference with mislabeled medical images. And so some case studies are work lists. A lot of radiologists may be specialized, and mislabeled studies might end up on the wrong work list. That then will mean that the radiologist will have to realize it's the wrong one, contact the PACS admin and get that routed, taking up time. Additionally, teleradiology and telemedicine, those after-hour calls are often routed to those third parties. If the information is not of high quality, if it is mislabeled, a lot of times the hospital will have to go find that to get to the right radiologist. Again, taking precious time. Prior studies, many diseases require prior studies. As a general rule of thumb, 99% of all relevant studies in the past 2 years. Mislabeled studies that fail to match the FETCH protocols will make radiologists have to go search for prior, assuming that there is a prior, or go on reporting without that prior if they can't find it. Finally, third-party use is the other one we're going to talk about. Disease registries, medical research, pharma, and education, clinical trials, etc. They all have their systems that have strict requirements to them regarding privacy, content, and format. And the data needs to be complete in order for these people and these organizations to do what's needed with the data. And so those are kind of the main case studies. We do have quite a few other case studies for routing data. And it really, when it's mislabeled data, it doesn't get routed correctly, it really impacts the workflows of radiology, but also, different enterprise processes downstream. Analytic solution is Endex. It is using computer vision and natural language processing to look at medical image data, pixel data, gross anatomy, the metadata, and make inferences about that data. It can pull the modality, body parts, presence of contrast, laterality, and a lot more from that data. And it standardizes the study and series descriptions based on what is seen. We do have 1 minute left. If there are any questions, I will take those questions. If not, data standardization does impact not only workflows and routing, but it impacts interoperability, data analysis, and tracking patients, and what's going on with their health. And so if this is something, that's of interest to you on how to improve your workflow, routing with medical imaging data, feel free to reach out. We will be in contact with you. If you want to put your information into the chat, we'll reach out to you and kind of see what types of issues you've been facing and how we can solve those. Otherwise, on Analytic.com, you can always go learn more there. We have a lot of articles, case studies, ROI calculator, and a lot of things that you can get from the website before reaching out for a demo if that suits you better. I hope you all have a wonderful day. I'm not seeing any questions. And that is a wrap for the first live first five here from Analytic. Thanks.